Representatives Juvenile Justice Committee meeting, and today we have an agenda with House Bill 177 on the agenda. But before we get to that, we have some very special guests that I want to recognize. We have the Director of the Georgia Bureau of Investigation, Vernon Keenan. If you wouldn't mind just standing up, please, Mr. Keenan. Thank you for being here, sir. Very much appreciate you being here. Arlie Mae Gray. Ms. Gray, great to have you here. Director Bobby Cagle, Division of Family and Children Services. Thank you, Director. Commissioner Brenda Fitzgerald, Department of Public Health. Thank you very much, Ms. Fitzgerald. Judge Peggy Walker. Let's see. She's from Juvenile Court of Douglas County. She may be in just a few minutes. Director Harris Blackwood, Governor's Office of Highway Safety. Thank you, Mr. Blackwood. Excuse me. Those two last names got me. John Carter, epidemiologist for CFR. Thank you, Mr. Carter. Brenda Jenkins, compliance investigator. Brendan Jenkins. Thank you, sir, for being here. We also have Vicki White, from an investigator from well, not here today. Mr. Jenkins is representing them, and Amy Jacobs. Thank you, Ms. Jacobs, Department of Early Care and Learning. All right. Without further ado, I sure would like to hear from regarding the child fatality report. You going to take that off?
Mr. Chairman, members of the committee, thank you for the opportunity to come here and present to you the Child Fatality Review Panel annual report for calendar year 2013. And I've asked the staff to do an executive level briefing of the highlights of what the annual report. Now, as the committee is well aware, the state of Georgia has had a child fatality review process since 1990. Each year, the process has been further refined to the point now that we have a very accurate annual report that has a lot of interesting data, which is valuable to all of us that are involved with the welfare of children and protecting children and preventing deaths. The state law requires that every child under the age of 18 years of age that dies suddenly, unexpected, or unexplained, that there be a review of the circumstances of that death at the local level. And that review is done by a committee which is comprised of different professionals from law enforcement, coroner, medical examiner, DFAC staff, on and on, that come together and review the circumstances of that child's death. That information is then forwarded up to the state of Georgia, where we have a child fatality review panel which takes all of the deaths from across the state of Georgia, reviews them, and compiles a report that you're going to get a summary here today. Last year, the legislature transferred the responsibility, the administrative responsibility for the Child Fatality Review Panel and the staff over to the Georgia Bureau of Investigation. That is now a unit within our agency. That was an important move because we are in the business of investigating child deaths across the state of Georgia in our investigative division and with our medical examiner's office. We also work with all the parties that are at the local level, from the coroners to the district attorneys, on and on. So we're able to collectively pull together information which is needed to do this annual report. Now, with that, I'd like to introduce Special Agent in Charge Trevor Randall, who is going to introduce her staff, and we'll go immediately into the presentation because there's some information here about child fatality, which I think you'll find very interesting.
Just before we do that, this is a good time to recognize Judge Peggy Walker from the Juvenile Court of Douglas County. Thank you for being here, Judge. All right, go right ahead.
Okay. Thank you. Trevor.
Thank you, Director. Thank you again for allowing us the opportunity to present this very valuable information to the committee chairman. I wanted to introduce myself. As the director said, I'm Trevor Randall. I'm a special agent as well with the GBI. And since we took over the responsibility for CFR in July of last year, we've been working on the annual report that you see, which is calendar year 2013, and it'll be presented in high detail in just a few moments. Briefly, I want to introduce the staff who is with us and also highlight Ms. Ashley Wilcott walked in too. Ashley, we didn't want to leave you out, our Office of the Child Advocate, who actually had been working with the Child Fatality Review Panel and its oversight and really helped GBI transition the office back in July. So I want to thank her publicly for that. With us today from the CFR office at GBI, we have Elizabeth Andrews. Elizabeth, if you would stand up. Chinyere Nwamu, and Arlema Gray, who will be presenting just a moment. And you've already mentioned Dr. John Carter, who I like to tell everybody is honorary GBI CFR. He's been working with CFR since its inception, and this report, we would not be able to put forth this report without his work as well. So we're going to turn it over to Alima to go through the report. If you have any questions, if we can just hold those at the end. I believe the committee has an electronic copy of the report, which was provided previously. I have cards here with the email information. If anybody needs any additional copies of the actual report, we'll be happy to give you those as well. Alima? Thank you.
Hi, good afternoon. Thank you. So I just want to show you some of the highlights from the annual report that you all should have received already. So this is just a quick overview of the mission and the activities of the Child Fatality Review Panel. These are the things that we focus all of our time on, is providing the highest quality child fatality data, as well as training and technical assistance to our local review teams. We provide investigative support services and any resources that the local communities might need in terms of reviewing child deaths or for prevention of those deaths if they find that prevention efforts can be useful. The mission of the panel is to promote the more accurate identification and reporting of child fatalities, to evaluate the prevalence and circumstances of child abuse and child fatalities, and to monitor the statewide child injury prevention plan. So these are all the things that we really focus on as the staff of the panel. If you're unfamiliar with the way that Child Fatality Review works, the timeline is this. So our committees at the local level in every county review sudden, unexpected, or unexplained deaths of children who are younger than 18 years of age. Within 30 days of a death, the County Child Fatality Committee chairperson should have received that notification that a death occurred and should have convened the full committee to begin reviewing the history and the circumstances of that event. Within 3 months of the child's death, the committee should have finalized their report and submitted that electronically to our office. Although periodically that does take longer, but 3 months is the time frame that they're working from. So Child Fatality Review, we really operate under the assumption that we are a public health surveillance program, which is the systematic collection, analysis, and interpretation of health-related data for prevention and planning purposes. That's what we convey to our local review teams, and all the information that we collect in our Child Fatality Review form we use for this purpose, to develop prevention programs and services and to support other agencies in their programs and services. So some of the findings from the report this year, again, this is calendar year 2013, we did find that the infant mortality rate in Georgia continues to be higher than the national rate, and the rate for African Americans as a population is higher than the state rate. Sleep-related deaths for infants is the leading cause of our reviewed deaths. Again, deaths that are reviewed are unexpected, unexplained, or suspicious circumstances. Motor vehicle crashes continue to be the leading cause of death for children over the age of 1. We did see an increase in the number of reports that we received due to maltreatment, motor vehicles, and fire burn injuries. One thing that's interesting, we ask our child fatality committees if these deaths are preventable, and most of the time, the reviewed deaths, they said, yes, these are preventable. So then we work with them to develop prevention strategies, programs, and services. So this chart just shows you the infant mortality rate for Georgia compared to the national rate. And you can see the taller bars there for African American. That rate is higher than the state rate. So that's an area that we want to work on. Infant mortality is due to several causes. But we're going to focus on the sleep-related. The American Academy of Pediatrics has issued a policy statement in the fall of 2011 that described a safe sleep environment, and these are some of the things that we are looking at when we are doing the local reviews. The location: a safety-approved crib, bassinet, or portable crib with a firm mattress and a tight-fitting sheet is the recommended sleep location for infants. However, only 28% of our reviewed infant deaths occurred in this type of location. We ask that the best sleep environment for an infant, they be placed on their back. Only 30% of our reviewed cases were found on their back. Sleep surface should be separate from adults or other children. We do not recommend bed sharing. However, half of our reviewed infant deaths were reported as bed sharing. And most of the time, we do see an environment that has loose blankets, pillows, comforters, and stuffed toys. These are, again, not the recommended sleep environment. So our committees are using this information to develop prevention programs and services. You can see by the data here that the adult bed was far and away the location where most of our infants were found. Most of our sleep-related deaths that are reviewed are kids younger than 4 months of age, so this is an area where our teams are wanting to do some additional work. And when we talked about the age of the caregiver, a lot of times we want to find out if there's some information that we can provide to families, if these are young parents or if they're older parents, but what we're seeing is most of the time they're between 20 and 30. So the recommendations from the Child Fatality Review Panel based on this information was to create a consistent and coordinated campaign for infant safe sleep that's better aligned with the recommendations from the American Academy of Pediatrics, and also to incorporate infant safe sleep education and safety concerns with child welfare professionals, early childhood education providers, healthcare providers, and home visitors. So we also looked at injury-related deaths, and of those unintentional injuries, you can see that top line all the way across. Motor vehicle fatalities, we had 102 that were reviewed. That's more than half of all of the unintentional injury deaths. So motor vehicle is an area of concern for our review teams. This chart is a little bit busy, but you can just see that when restraint use is measured, most of the time we're seeing that they need, for kids under the age of 8, a seat belt, or a child safety seat. And we're seeing there were 9 who either were improperly restrained or not restrained at all. And for those children age 8 to 17 who need to be in a seat belt, we saw 21 who were either improperly restrained or not restrained at all. So that's an area where our local review teams are wanting to do some additional work. We also look at pedestrian deaths, and this is an area of concern. You can see that we have a lot of those across all age groups. The recommendations from the Child Fatality Review Panel to continue to enforce the Teenage and Adult Driver Responsibility Act, TADRA, so that we can support young driver education and reduce the risk with newly licensed drivers, to encourage parents and caregivers to model appropriate driving behavior, to support the activities of some of our local coalitions, including Safe Kids Georgia, and to continue media campaigns and education on child passenger and child or pedestrian safety. So a lot of our local committees are wanting to do this work. Suicide is another area that we were seeing. You can see from this chart that the demographics of our suicide-related deaths, white males are the largest population here. We ask for risk factors so that we can understand if there are some areas where we need to do more education and awareness. And you can see that most of the reviewed suicide deaths reported that there was a family discord. There were also many of our children who had prior mental health services or school-related issues. So these are some areas where our local review teams are wanting to do more education and outreach. The recommendations from the Child Fatality Review Panel include requiring newly licensed educators and service providers to complete suicide prevention training, and to increase funding for the suicide prevention program to expand it statewide, including implementation and evaluation of means restriction education at hospitals. We do collect information on maltreatment, and this just shows you that we have maltreatment history with a lot of our children across all age groups. Historically, the cause of death where maltreatment was the direct cause we see as homicide, and that's been the same for the last 3 years. 2011, 2012, and 2013. When the child has reported an open CPS case, most of the time we're seeing these deaths are sleep-related or they're due to medical circumstances. So that's an area where we need to do more education. The recommendations from the Child Fatality Review Panel include encouraging availability of affordable child care for all families, increasing community education on domestic violence and child abuse, and supporting early childhood home visitation programs, as these are shown to be evidence-based. So that was just a sampling of some of the data that's included in our annual report. The full report is available on our website. You can see here, gbi.georgia.gov.
Thank you very much. Certainly appreciate that. The that gives a lot of insight into what's going on out there and how we can try to form policy that meets some of the problems we have, or hopefully addresses all of them, but I don't know if we'll ever get that. Let's see. Got a question. Is that you? Representative Welch.
Thank you, Mr. Chairman. To the panel, thank you for taking the time to review this information, to go over it. The one topic that has come up in discussions in the off session has dealt with predictive modeling, ways that the files from the caseworkers, that information can be channeled into a central database so as to better recognize potential problems. These deaths here, and being that they're automobile and sleep related, may not be able to be captured, but the other ones that we dealt with burn issues, homicides, and abuse, what if anything has the panel looked into, or the agencies themselves? I know that Commissioner Cagle and I have spoke about this before, but what modeling can be done, what predictive analytics can be utilized, what software can be used to try and help caseworkers identify, especially given the load that they're facing. Obviously, we have budgetary issues where we're addressing more caseworkers, but still, is there a way to automate or to assist the caseworkers in identifying situations that might be indicative of a situation that could be harmful, even deadly to the child?
Thank you, Representative Welch. At DFACS, we are looking at predictive modeling in order to try to get to especially the homicide-related deaths. The progress that we've made thus far is that we've been working with Andy Barclay, who is a biostatistician himself, also a Georgia resident. You may know him as the chief funder for the Barton Child Law and Policy Center at Emory University. He has been working on the development of that model. We are, as a matter of fact, I was arranging a meeting for him with my staff in the next couple of weeks before I came over today to begin the pilot of that project. This is a relatively new area of practice in child welfare. It's been tried by a couple of other states, and it's being evaluated currently. The state of Florida is probably the one that has the most advanced work on this, and they have just let another grant to expand their use of predictive modeling. So I'm hopeful with the next 6 months we will have some preliminary data and some experience behind it to be able to tell you how effective we can make it here in Georgia.
Thank you, Commissioner.
Thank you, Representative Welch. Representative Oliver.
Thank you all for the much improved product on this. I know that it's been a very collaborative and high quality effort to reach this point on these reports. I have two questions. On page 28, I printed this out, the sleep related deaths for children who were already in Child Protective Service arena. The report doesn't tell me whether you have an opinion that the sleep-related deaths were directly related to neglect. And I'm curious whether the panel, the state panel, is reaching a conclusion that there ought to be perhaps more prosecutions for neglect that directly relate to sleep deaths. Do you and Judge Walker may have an opinion on this. Are sleep deaths a product of neglect? And if so, should they be prosecuted? I could also ask the question about homicides. Are homicides a result of neglect, and should they be prosecuted for neglect?
Well, having come from a very traumatic weekend where we
Right.
had a lot of deaths of children and making custody decisions about who takes care of the surviving children, we've got some very serious issues. But let me talk about the sleep deaths first. The issues that we run into is that it's very hard to get a real clear-cut answer. So we've got to improve in our investigations and our documentation. We have to always be screening for three things. We have to screen for substance abuse, because many of the sleep-related deaths have to do with substance abuse, and we're not necessarily identifying that issue. The second thing that we're not always looking at is the mental health piece. We have a substantial number of women in our communities with serious mental health diagnoses, and I'm talking about women who are actively psychotic. When we moved from using hospitals to community-based mental health, it changed what happened to these children. When women who were psychotic had children and we were dealing with a hospital system, those children were placed with relatives. Now they are left in the home unless the mother is actively psychotic at the time of birth. So we have to look at the substance abuse issue. We have to look at the mental health issue. The third area that we have to be screening for in all of our abuse and neglect cases is domestic violence. That, in Georgia, as you know, we have been at one point the 7th in the nation for men killing women. We're doing better in terms of how we have done. We've written a state plan during the time that I served on the commission. We're doing implementation of that plan. We have to do the same thing with this work that we did with the Commission on Family Violence. We write a plan, but we have to write an implementation plan. We have spent 10 years writing recommendations for child fatalities, but we haven't started writing the implementation of the changes that we're going to make. We're in a wonderful situation with very stable leadership, very integrated leadership, and we have the ability now to write implementation plans to reduce the number of deaths that we have from our sleep-related work, from our abuse and neglect work, and certainly in the area of domestic violence. This is one of the things that I've brought up repeatedly with the GBI, is we are seeing many, many more fatalities now as a result of the perpetrator killing the partner and killing the children and then killing themselves. It is happening every year in multiple cases. So we have to have integrated work between the Family Violence Commission and Child Fatality Review and the Department of Family and Children's Services and law enforcement if we're going to be effective.
That's a very helpful, forward-thinking answer, and I appreciate all your work in that effort.
And Representative Oliver, I wanted to speak to the sleep-related deaths. If you look at the total number of deaths for DFACS during the period of 2013, there are about 180 of those. Of that, 23% were for sleep-related deaths. And I've done some further analysis of that also. About half of those were rollover deaths, meaning that someone, an adult, was sleeping with the child, rolled over, and smothered the child. So those are very preventable. I think the other thing that's very telling is if you look at the percentage of overall deaths in the state during 2013, about 7% of those were sleep-related. If you look at the DFACS deaths, 23% were sleep-related. So I think your question regarding whether there's neglect involved is a good one, and based upon just the face of that, it appears that there may be a direct correlation between the two.
Thank you. May I have one other question, Mr. Chairman?
Yes.
This is really for Dr. Fitzgerald, because you have brought to our attention the very good work that Georgia has done to reduce the deaths of babies in the first day. But half the children that die on their first day of life. Is that correct? Is there any analysis anywhere whether or not those deaths relate to neglect?
We do have an analysis of why we're losing babies, and that the number one cause is prematurity, right. And most of those in that first day have to do with prematurity, with the complications of prematurity. The second largest number of cases of infant mortality has to do with genetic problems, with genetic defects, and then the third one has to do with safe sleep. And if you look at, and it's true that we certainly have to, and we especially, I think, have to concentrate on this safe sleep part, because we've been making some real progress in our prematurity, but this safe sleep is a stubborn number to bring down. The total number of infant mortality in this state, we have been, if you look at the nation's health rankings, we've been in the 40s out of 50 for decades. 3 years ago, we were at 44. The year after that, we were at 34, and this year we're 31. So we're making some improvement. And if you look at actual numbers, we have reduced since 1990 our infant mortality by 48%. So that's great. But a lot of that progress is that medical progress piece, and where we really, I think, need to concentrate, and we would appreciate help with cooperative efforts with the state, is in that sleep-related piece.
Representative Bell. Representative Evans.
Thank you, Mr. Chairman. With such a large number, according to the chart, of those sleep-related deaths being because the children were in an adult bed, I'm wondering if there is already a requirement that y'all have in place when you place a child, that you make sure there is actually a crib in the home. Is that a requirement? That are just not being used, apparently.
If I could pose a question and follow up with that. When the crib is in the home, how do you go about verifying that they know how to use that and what not to do? Really is, I guess, the question.
And that's a good question, Chairman. That's one of the number one issues, being somewhat ignorant to all of this coming to CFR. It seemed like it was that simple, increase the resources for the counties who have the crib giveaway programs, from the time the infant leaves the hospital. And what we were finding out is that they send the cribs home, but they're not using the cribs. In many of the crime scene photos, you'll see that the cribs actually have clothing in them. That they're being used as laundry baskets. So again, that education piece that Department of Public Health and DFACS, everyone is working towards that awareness piece of what to do, what not to do, the safe sleep environment. And the director, I don't know if he mentioned, but may want to talk about an initiative that we're starting now for that awareness piece, because we haven't had a statewide campaign for that. But it is to raise the awareness of, it's not good enough to bring the baby home and have the environment there, but you have to utilize it as well.
We've partnered with the Child Fatality Panel, and we're in the process now of working with Georgia Public Broadcasting to produce a training video that talks about unsafe sleep practices. This video would then be provided to DFACS, Public Health, everyone across the spectrum, PTAs, anyone who has an interest in children, to educate about unsafe sleep practices. So we've got that on the fast track. We'll also be asking the governor to do a public service announcement over unsafe sleep practices. So we're going to come out with a public awareness campaign. Second thing is, speaking as a law enforcement officer, I believe that where we're headed to in the state is that we need to have more prosecutions of caregivers who, through neglect, have caused the death of a child. Someone who is intoxicated or is using drugs and they're co-sleeping with an infant who winds up dead. The current practices now is that this is a tragic accident. Everyone feels sorry for the parent. But I think we need to go pursue criminal prosecution when there's neglect there. I also believe this is the same case with firearms in the home. where a caregiver has a firearm in the home, is not properly secured, a child gets that firearm and kills himself or another child, we need to look at criminal prosecution in those instances. So this is, that's me speaking as a law enforcement officer.
I thought I'd seen that tone before. And I appreciate that. If I could pose a follow-up question to that, Commissioner Keenan. The use of drugs, now, when you say use of drugs, is that illicit drugs, or does that include both illicit and prescription drugs?
It would be across the board.
Across the board.
You know, one of our major drug problems is abuse of prescription drugs. It's not just illegal drugs.
And so what we're having is we've got these folks. I mean, the big problem is the prescription drugs that are being used improperly.
Yeah.
That's what you're talking about. You're not talking about somebody who's following the orders, generally speaking, of the physician taking those prescription drugs.
No, the issue becomes, you know, it's one thing to take drugs, that's fine, prescribed or unprescribed. But when you put the infant in the bed with you, that's the problem. That's reckless. That's reckless conduct. And we see this through the investigation. Of course, what we're going to concentrate on with the child fatality investigation GBI does is honing in on those issues looking towards building a criminal prosecution case. Don't sleep with the child. That's the, you know, we got to educate and we got to follow up when tragedy occurs.
Yeah. Thank you. Yes, ma'am.
And let me add one thing to that. In the child fatality review for this year, 72% of the time there was an adult in the bed with the child.
And so, does that indicate that in that 72% of the time that the adult was rolling over on the child or somehow impaired the child breathing?
Yes.
And that's where those drugs, they can't wake up. That drug war's worth fighting. Thank you very much. I certainly appreciate you being here, and it did a wonderful job, and it's been educational to me, and I feel pretty sure to the rest of the committee. And keep doing the good job you're doing. This is it's a great fight that we're in. Again, thank you for being here. You did an excellent job, and thank you for providing us with copies of that report. We'll take a brief break. Be back at 2:40. Thank you.
Representing the school counselors, and Representative Joyce Chandler was great as far as being a retired school counselor and giving her insight. What this bill does simply is to kind of close that reporting loop that we were in. Basically, any mandated reporter would require within 24 hours of seeing suspected child abuse have to report it to the state. Once it was reported to DFACS, what was happening is there wasn't necessarily any feedback saying we have your report. And then when the case was resolved, there was nothing that said the case was resolved. So your school counselors and other personnel were not being informed as to the actual what was going on with the case. And so they could be looking at a child and know that something's going on, but just not know where it is. So what this bill does is two things. One, within 24 hours after receiving a report of suspected child abuse, the agency would then send a report back saying, we have your report. So we acknowledge that we received it. Then, once the case is closed, within 5 business days of completing that investigation of suspected child abuse, they'll report back to the school counselor that either it was confirmed or unconfirmed. If it's unconfirmed, then the school counselor can then escalate. If it was confirmed, then they know how they're proceeding. So it basically it deals specifically with school counselors because they are our first line of defense in many, many cases. And as I said, it passed out here last year, and I would love your support and due consideration. And I'm taking any questions you may have.
I mean, do we have anybody else signed up to speak, or anybody wants to speak on this issue? Okay. Okay. Who we got? Is that you, Emma? No. Okay. What do we got here? Go ahead, Ms. Chandler. Representative Chandler.
Thank you, Representative, for bringing this to the front. We don't want any child to slip through the cracks. None of us do. And this is just a way to prevent that from happening. It's also a way to let school counselors and other school personnel who may have been involved know how to best work with a child. So by getting information, and we know DFACS workers are terribly busy, but this will also put them on a schedule to know to get back this information to the school. Thank you.
Representative Spencer.
Thank you, Mr. Chairman. So make sure I understand this, when any mandated reporter, that's healthcare provider, or is it just school personnel that are considered mandated reporters? So if somebody's a healthcare provider and they report a case, does that automatically alert a potential school counselor?
No. What this is whoever, if the school counselor is the reporting personnel, it comes from a school, okay, then they would report it back to the school. It does not impact any of your other mandated reporters.
Representative Welch.
Representative, thank you for bringing the bill. One overarching question, I guess, is, why is it of particular interest to school systems to know this information, or to the counselors to have this information? That's my first question. I have a couple of follow-ups.
Okay. No, thank you for that question. And as we had talked about that, I guess, last year, because that was a very good question. The school counselors tend to be your first line of defense. The teacher is sitting there looking at a child day in and day out, and they will know if that child is coming to school and has not eaten or has not slept or may be suspected of child abuse. And so because they are that first line of defense, we thought it was important to close that loop, because sometimes what happens is you may have a school counselor who reports a case to DFACS, and then they don't know the situation until an angry parent comes in there and says, why did you report me? Or the case may be closed and they just didn't know, and they heard through the grapevine that there was really something going on. They reported the second time, and then when it was reported the second time, then DFACS confirmed that there was an issue. So really it's just making sure our first line of defense has the information they need, that that's available to them, but it's being reported in a timely fashion.
And I guess I understand the need for, I understand the first part of subparagraph B, which is to talk about a confirmation, if you will, that the report has been filed and it's acknowledged. I'm getting to the second part as to why it is that someone in the school system needs a confirmation that there was either confirmed or unconfirmed child abuse.
Okay. No, that's a good question. And if we need to add on to it, I mean, Mr. Gamble could add on to it. But suppose you have a teacher that's looking at a student. This has happened before, where they look at the child day in and day out, and they've reported the defects. Once they know the case is closed and it's been unconfirmed, they can then look at the child and say, I know 100% for sure that that child is being neglected. They can then report it back to DFACS. If they don't have that confirmation, what would have to happen is they would just have to keep reporting it to DFACS, not knowing whether it's resolved or not, and then that's just additional information that DFACS has to look at. But that's the cases that I've heard where if they don't know, they just have, the only option they have is to report it multiple times.
Then and this is a question that you may not know the answer to, but it does create a question in my mind that if once confirmed, then what you're saying is that by virtue of having the confirmation that there has been abuse, that would not absolve the teacher from then reporting any subsequent abuse. So it still kind of does continue on. Does it just provide some level of heightened alert, if you will, some heightened awareness for the teacher to monitor the child? And is that what we're achieving with that in part?
It would. I mean, once it's confirmed, then you have to, and we would have to assume that DFACS is taking some due action for it. It's really those cases where they just don't know if it's been confirmed or unconfirmed. And like I said, if it came back and it was unconfirmed, but I know that child has been in the same clothes for 5 days or has not eaten and comes to school hungry, then I know that I need to once again get back and escalate it again, because they are not then doing what we think they should be doing in that case.
And then one last question, Mr. Chairman. What, if any, is there any penalty for someone, for the agency, if they do not report back to the counselor within the 5 days, or to confirm or unconfirm the child abuse?
This specific bill does not have any penalties per se in it. It's really, and I think some of the discussion that we've had has helped a little bit, but it does not have any specific penalties on it. Now, I will say the penalties for a mandated reporter not doing their piece of it is potentially getting fired as well as jail. So, and we've had some situations in Cobb County where people have gone to jail for not reporting within that 24 hours. So it's a very sensitive and important topic. But thank you for that question.
Representative Oliver.
I want to answer that question also, because after law enforcement, teachers are the biggest group of reporters. And my experience is that in many cases, the DFACS and school people are not working as partnerships in the partnerships that they want to work together on. And the lack of information that flows back to the reporter is really defeating of a partnership. A child that goes to school every day that's very neglected at home, his or her best chance of protection come from the school personnel, day in and day out. And it's the children that suddenly become truant, particularly after there's been an ongoing inquiry. The fact that the child becomes truant and disappears from the school is a huge red flag. The partnership between DFACS and school has to be enhanced. And this bill really goes to that partnership.
Also, and I'm going to address this to the author and to Representative Chandler and Representative Oliver. I think that the bill, the way it's crafted, the person that shall receive the disclosure from the department will be the school counselor for the school. And I think that if I remember, the reason that we're telling the school counselor is because the school's counselor's job is to counsel the children or the child who's in abuse. Is that what you recall?
I think there's a hierarchy of reporting too.
Mm-hmm.
Schools have
Yeah.
their own account systems about that.
You are. A lot of them report through the school counselor, I know, in certain counties, right? Most schools do.
Mr. Chairman, I think, Representative, I think the version that was last year, the initial version, I think, did have it reporting back to the teacher directly, if I remember correctly. And then did you modify it to do school counselor to address that particular issue to make sure?
We did. The committee took some effort, and we kind of made a few changes last year in committee to make sure that it went back to the school counselor. Yes.
The appropriate, yeah.
Yep. Mm-hmm. You guys put together a very good bill last year.
Representative Evans.
I think she's still on from last time.
I'm sorry. Okay, who we got? Who's he?
You got a question?
You have? Okay. Okay. All right. Any other questions from the committee? All right. Yes.
The one concern that I do have is I just want to make sure that there is a penalty or any repercussion for a member of DFACS that should report this back and then does not. That's kind of the only question, unintended consequence that I see here. And I know the bill itself doesn't say it, but sometimes we'll have a catch-all provision into the code, and then that question, it could pose a penalty. I don't know of any, but that's just one question that I have. I don't know if Ms. Travis has had a chance to look to see if there was anything there.
Nothing in the code section itself, but whether there's other parts of the code, I can't be certain.
Okay. And as I'd mentioned, I know Ms. Fielding's here, and you had said before that DFACS was fully supportive of this bill in the past, and I'm assuming you still are.
Yes, we don't have a problem with the bill as it is. Currently, DFACS policy requires that we respond to mandated reporters upon receipt of a report of abuse or neglect. What that letter looks like is it says we either screened out this report, we assigned it for investigation, or we referred it for family support services. And then the letter also lets the reporter know that they're able to ask about the disposition of the report. They're able to do that by law. The issue that we have, particularly in the case of Cobb County that Representative Wilkerson is talking about, is sometimes this is a manual process, and so it's open to human error. We believe an automation in our SHINE system, which is our child welfare information system, would allow us to fit for the promise of the bill.
Okay. Thank you, Ms. Field. Representative Quick.
Thank you, Mr. Chairman. And to Representative Welch's point on this, from my perspective, I think it might depend on whether or not the language is viewed as a discretionary or ministerial function at some point to get to the point of what I think your question is in terms of whether or not there would be a waiver of or any immunity by the government employee. I think is probably what your concern is, or at least your question is at this point.
In part, yeah.
And that's always a difficult issue, too. It has to be ferreted out every case. Okay. Any further questions or comments from the committee? Any further comments or questions from the audience? Yes, ma'am. Could you identify yourself? And
Denise Rebels, Atlanta Public Schools. I would like for social workers to be added in addition to the counselors. Because we're also mandated reporters and we report to the school districts.
okay. Okay. Now, Ms. Rebels, if I could just ask you a question too on that. You want to add social workers, correct?
Yes. In some school districts, the counselors are the primary reporters, and in others, school social workers are the primary reporters.
Okay. Yeah.
And I guess in those cases, that's why we had put the principal in there, but you would rather go to the social worker versus the principal since you are the initial mandated reporter.
Yes.
Yeah, no, I agree. Yeah. Have a school counselor.
Yeah, go ahead and address hers.
Ms. Revels, would you mind stepping to the microphone over here, please? And for the committee, this is Denise Revels. She's from the Atlanta Public School System.
Yes.
And you're a social worker.
Yes.
Okay. And what you mentioned just previously was that you'd like to see that social workers be added to this statute. Now, when you say added to the statute, do you have a copy of it?
Not in front of me.
Could you get her a copy of the statute? Yeah, that's got it. That's got it. Okay. And what you're asking for is that social workers be included to receive this information. Is it the report or the confirmation of by the Department of receiving a report of child abuse, or the
confirmation that the report
confirmation? Okay.
Whether it was confirmed or unconfirmed?
Okay. Now, could you just explain to us, I guess it's kind of we have a provision in here that, I think it's the last line or so, that says that if a school does not have a school counselor, such disclosure shall be made to the principal. And that comes from we had this bill last year, and what we did was, if there wasn't a school counselor there available to receive that confirmation or report of unconfirmed abuse, then the principal would have it, and then the principal could deal with it accordingly. Now, and I guess I think we put that in there because of the procedure and the hierarchy of reporting requirements is where we had that. That's where we came up with that language. Now, if we, the school social workers, now, could you just help us understand a little bit about the situation of a social worker in a school setting in Atlanta Public Schools?
So on line 20, where it says completing the investigation of the suspected child abuse, such entity shall disclose in writing to the school counselor or school social worker. That's where I want it added there.
Mm-hmm. Now, so what you're telling us, I think, is that in some Atlanta Public Schools, the social worker is the school counselor.
No, those are two separate roles, but in several school districts across the state, those cases of suspected child abuse go directly to the school social worker. They don't necessarily go directly to the counselor. In some districts, those cases go directly to the counselor. So it depends on the school district.
Okay. Well, we may have.
No, wait a second. Well, go ahead.
Representative Sharper.
Yeah, you have a comment, Mr. Gamble, that you would like to make from the School Council Association?
With Matthew Gamble with the Georgia School Counselors Association, and I think that the intended goal of what we're trying to do here might be negated by such a recommendation. I'm not exactly sure that social workers are actually in the school building on a daily basis, and I think that that's the importance of the role that the school counselor in this case plays in what we're trying to address in this legislation. So I don't think that opening it to the social workers is necessarily in the best interest of what we're trying to address here.
Okay, well, just a second. Let me ask you, the issue in Atlanta Public School System, one you work in, would the school social worker be on site at the school?
Every school is assigned to a school social worker. So once there's an abuse case that comes to the level where a report needs to be made, the social worker makes all of the reports for the entire school district. So the social worker is called upon to come to the school and make that report, interview the child, make an assessment, and make that report.
Okay. And then the school counselor doesn't get involved in this type of information.
Not
exchange.
In some school districts. In some school districts.
In Atlanta Public School,
in Atlanta,
they do.
No, the school counselor is not involved in the case at all.
Okay. Well, that's an issue. Okay. Okay. Representative Oliver.
Do you represent the School Social Workers Association? I don't see a lobbyist tag.
I am a member of the School Social Workers Association of Georgia. I came here to meet Wendy Clifton, who is our lobbyist, but I don't see her.
Right. And you're perfectly welcome to come. Any citizen of the state's welcome to come.
Yeah.
But I'm familiar with the association, and I thought they had another lobbyist. And so I'm confused, and I should know this, I don't. Is there a different statutory definition for a school counselor and school social worker? Is it totally, I think there is, and I think it's a totally...
There are two different professions in the school district, and they're both employed by the school district.
But school counselors are in the building, and school social workers are assigned multiple buildings, is my experience.
The school social workers, well, for my district, some schools may have one social worker, like the alternative school has one social worker that's there every day that's assigned to the school. Some of the high school social workers have two schools, so they have a high school and an elementary school they're assigned to. So if a child abuse case comes up, they're called from the high school to go over to that elementary school they're assigned to make a report.
Okay. What's that? Okay, Representative Spencer.
Representative Oliver was kind of getting to my question. If we choose to include social worker into this bill, should we, I guess this is for the committee to think about, should we use the word assigned social worker?
Okay. Well, let him pose the question. Pose your question again. I'm sorry.
It's sort of kind of what I was thinking with my Representative Oliver. If we choose to put social worker into this bill, should we put assigned school social worker? Because there may be a statute that defines school social worker in the code.
We have some rules and regulations, and we have some school counseling statutes. Then we also have a few other things that are going to be included in here. We may have to look at that. That's one of the issues we may have to look at. Representative Sharper.
Okay, from what I'm hearing so far, in line 21, where it says writing to the school counselor, is there any way that we can actually say writing to the designated reporter of abuse, and that take care of that whole situation? You don't have to go into school counselor or social worker. Whoever's designated for that particular school, that's who this needs to go to, because they're already doing it. So you're not overlapping, because you may have a school that has a school counselor, and then you may have a social worker that works in with that same school for the whole district. So we need to make it aware who's designated probably for that particular school, and that will take care of the whole situation. This is my opinion. And get out of different names and things like that. And then at that point, if a school does not have, because you can take out that point, because every school should have a person that's designated to report abuse. So you wouldn't have to say if a school does not have a school counselor, such disclosure shall be made to the principal, because if they don't have a school counselor, but they have a social worker who handles that, then you wouldn't even have to get the principal involved, and that's taken care of. So somebody's designated for all schools, right?
Yes.
Okay, so that's who we're having to get this information to, the designated reporter.
Okay. Thank you, Representative Sharper. Representative Chandler.
I'll defer to Representative Wilkerson.
Okay. Representative Waits.
Members, I just simply want to echo that this is the format that most of the schools in my district in the city of Atlanta follow, just as she's indicated, and this has been a major challenge for us. And so I would support the idea of using the designee to address that issue as well somehow, versus getting into the ramblings of the semantics of that language. I like the idea of designee.
Go ahead.
Thank you, Mr. Chairman. The challenge that we have is that I think we added the principal in there to capture these situations, that if there was not a school counselor, because technically by law, we are all designated we're all mandated reporters. So you would force DFACS in a situation where they may send a report to whoever, they would have to individually look at each school to figure out who that mandated reporter is. In this case, you don't necessarily want a situation where it goes to someone who's not in the building every day, because, like I said, this is the first line of defense. And I know we have vetted this bill over the last, year or so, and I know there's a lot of people that want to be, included in this, and for various reasons, very good reasons. But in this case, if you make it so that you're pulling those definitions out there and just putting any designated individual, that doesn't necessarily do anything. I don't, want it depending upon the school, and I'll lean the legislative council on that one as well.
Ms. Revels, if the social worker, they're not on each campus that they cover each day, I'm assuming they're not assigned one social worker to each school in the Atlanta public school system.
Every school is assigned a social worker. And so the social worker for the high school also is the social worker for one elementary school.
So I guess what I want to know is, so the social worker's not going to be in the high school all day, every day, because they're going to be covering with the elementary school also.
That's correct.
And if, let's say that so the counselor, if the counselor gets this information, the counselor would then either, as a matter of Atlanta public school system policy, would either have to transmit that information to the social worker or the principal, and the principal then transmit it. Okay. Well, that's definitely something to consider. And hold on just a second. Representative Quick.
Mr. Chairman, that was from before, but since you called on me, I'll go ahead and say something.
Okay.
I'm not going to speak for the author of the bill, but I read this to intend that the confirmation go back to the place where the child is, so that the person with most direct contact with the child can take the appropriate actions that need to be taken at the school level, not a district level. And then if the school does not have a counselor, then it would be the principal of the school, again at the school level, closest to the child, that this is for the child and for the child's purposes. Maybe I misunderstood, and now, lest you call on me again and I say something,
well, I may call on you again, but whether you want me to or not. Anybody else? Okay.
Yeah.
Gotcha.
Just quickly, she was mentioning that the disconnect. I'm looking at the disconnect also from the DFACS point of view. That we understand that they're closer to the children, but also the problem that we're having is the reporting. So when if the reporting is a problem, that's closer to the DFACS side. So therefore, whoever deals with the DFACS need to make sure they're on top of everything to make sure that it gets back to, even if it's the school counselor, if the social worker is looking over those schools or whatever, if it's the protocol for that social worker to be involved, then that is nothing that we can't go around that. So if it's in place, then that's what we need to look at. I mean, I'm for the bill, for the sake of the kids, but the language has to be right so we can follow the protocol.
Representative Dickerson.
I think line 16 states that it says school, and it defines school and not district. And I think that's where I think the clarity is at for me. So I would prefer the bill stay the way it is, because it's defining the school and not the district. And that way that the counselor and the principal are all in the same school and not necessarily the district. And I understand what the lady is trying to allude to, but I think, we vetted this bill and gutted it and vetted it last year, that we will be doing a disservice to the author if we did anything else to it besides what's here. And I think school defines what we're trying to do when we're trying to stay with the school and not the district. Not to take anything from anyone else.
One more question. Representative Welch.
This is for purposes of trying to clarify the bill and move it forward. Under OCGA section 19-7-5, those are our mandated reporters. Subparagraph J speaks to and enumerates school guidance counselors, visiting teachers, school social workers, or a school psychologist certified pursuant to Chapter 2 of Title 20. It may be helpful to refer to define school counselor as being that list of items. So we could refer back to that code section. That would capture all of what everyone is saying here, and you'd be referring to something that's probably pre-established in the school systems. If that doesn't work, that's just a suggestion. But I did want to make, if we're going to move the bill forward, I did want to also make an amendment that we put a caveat here regarding liability for someone that fails to meet the duties of this paragraph.
Okay. All right. What would be your amendment, Representative Welch?
The proposed amendment, not addressing the debate that's on the floor currently, but would be to add a subparagraph C.
That's uppercase C?
Yes, sir.
Okay.
To read, a failure to report or disclose as required by this paragraph shall not create any civil liability with respect to such duty.
Shall not?
Shall not.
And I have a question when it's appropriate time.
Go ahead.
Just curiosity, I understand the intent. Since school counselors and mandated reporters will go to jail if they don't report within 24 hours, I mean, just even from just looking at it from the outside, should we absolve defects of any type of liability? Not saying there is any liability, but should we absolve them of any liability that if I don't report, I go to jail, but if you don't do your job, then nothing happens? I'm just curious.
Yeah, the logic here is that, I mean, if you want them to be penalized, and that was the original question before, is there a penalty? If so, what is that penalty, and do you want the penalty, was the question earlier. I didn't get an indication that we wanted a penalty, and what we're talking about is a penalty for following back up, for having that back communication. The report has been done, so the child is supposed to be protected as a result of the report. That's mandated, that's done. Then the question is, after that, the follow-up to confirm that I received the report. If I don't confirm that, you want to penalize the social worker, the DFACS agent, the person that doesn't follow up and notify the school counselor, and then you want to penalize the person or the entity if the counselor isn't notified within 5 days after an investigation is completed. I didn't think we did, so that's what I was just trying to eliminate that issue, should it exist.
Yeah, I'm just curious. Another question, if you don't mind.
Because it's mandatory under this, so it's not discretionary. So if you fail to perform a ministerial duty, you can be liable for that.
Okay.
So
Point of order, Mr. Chairman.
Pardon me?
I just have a point of order. I don't believe that the amendment has a second.
Well, okay. I think you're right. All right. At this point, Chair will call the question. I hear a motion. So, got a motion. Do I have a second?
What are we moving?
Call the question. Yes, that's right. Is there a motion? Is a motion due pass by Ms. Chandler? Second by Mr. Sharper. Okay. All those in favor say aye.
Aye.
All opposed, no.
We're voting on the bill unchanged. True.
That's right.
That's what I think we just did.
Okay. There we go. I didn't hear any other motion. So there we go.